In today's health alert, the World Health Organization confirming that a person in Mexico has died from a strain of bird flu never before identified in humans. Bird flu concerns have been in the headlines in Michigan in this particular case. The 59-year-old man reportedly had underlying health conditions. Joining us with more is our chief health editor, Dr. Partha Nandi. Thank you for being with us again. And can you tell us about this case and how he may have gotten infected?
Yeah, this spooks a lot of people, right, Simon? The bird flu strain in this case is H5N2. It's the first laboratory-confirmed human case of the subtype. Now, the patient was hospitalized at the National Institute of Respiratory Diseases in Mexico City on April 24th, and his symptoms included fever, diarrhea, nausea, shortness of breath. Now, sadly, he died the same day from complications related to the bird flu. Now, according to Mexico's health ministry, the patient had multiple underlying health issues. That's important, including diabetes, high blood pressure, and chronic kidney failure. He had also been bedridden for 3 weeks prior, so was most likely in a weakened state before getting infected. Not to mention, anyone with these pre-existing conditions is at high risk for severe illness, even from our usual seasonal flu strains. Now, how did this man in Mexico contract H5N2? That's the question, right? We don't know that yet. The World Health Organization said the patient had no history of poultry or animal exposure despite 3 poultry outbreaks of H5N2 in nearby parts of Mexico. Simon, flu viruses usually circulate amongst birds, but can occasionally infect other species. Humans can contract this virus through direct contact with infected animals or exposure to contaminated environments. So that's important to know that.
And doctor, has there been any evidence of person-to-person transmission or connection to bird flu cases here?
And that's what we worry about, right? So thus far, there is no evidence of person-to-person spread. That's important to say. According to Mexico's health ministry thus far, 12 additional people living near the man's home were tested. 7 of them had symptoms. However, nose and throat samples from all 12 tested negative. Results from blood tests are still pending, and health authorities are looking for possible antibodies that would indicate maybe a past infection. Now, as for any connection to the dairy cow outbreaks that we've had here in the U.S., we've talked about that, right? There is none thus far. The strain that infected the 3 farm workers, Simon, was H5N1, different strain. Since 1996, there have been about 900 human cases of H5N1 reported worldwide, and roughly half of them died. And that's because bird flu infections can vary widely in severity, ranging from no symptoms or mild symptoms to severe disease that, as you can see, can lead to death. Now, while the risk to the general public from H5N2 is considered low, scientists are closely monitoring the virus, looking for signs of it adapting to spread more easily amongst people, because that's the worry, right? One person gets it, gives another, then you can give it to others. So far, we haven't seen that risk. So good news so far.
So important to be informed on this.
Absolutely.
Yeah. Doctor, thank you so much for being here.
My pleasure.
And coming up this week on the Dr. Nandi Show, with so many people complaining about not getting enough sleep,
That would be me.
Yeah. Dr. Partha Nandi goes in search of answers, from chronic insomnia to advice for new parents. Dr. Nandi is diving into all of this Sunday, June the 9th at 5 p.m.